Hello, and welcome to the Joslin Diabetes Center and Beth Israel Deaconess Medical Center's virtual panel, Diabetes, Obesity, and Nutrition. My name is Chihiro Sato. I'm the Communications and Outreach Officer at Joslin's Asian American Diabetes Initiative. May is the Asian Pacific American Heritage Month. Today, we will be learning about diabetes, obesity, and nutrition. Asian Americans are twice as likely to develop diabetes than the general population. And many of us are not aware that Asian Americans can develop diabetes at a lower body weight. Today, we are thrilled to have three experts with us. They will be guiding us with important information and sharing their thoughts on how we can prevent or better manage diabetes together, focusing on nutrition and what we should know about obesity among Asian Americans. Now, let us move on to presentations. First, I'd like to introduce Dr. Frank Hu, who will be presenting on nutrition and diabetes prevention and its complication. Dr. Frank Hu is the Frederick J. Stair Professor of Nutrition and Epidemiology and Chair of the Department of Nutrition at the Harvard T.H. Chan School of Public Health. He is also Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. His major research interests include epidemiology and prevention of cardiometabolic diseases through diet and lifestyle, gene-environment interactions and risk of obesity and type 2 diabetes, nutritional metabolomics in type 2 diabetes and cardiovascular disease, and nutrition transition, metabolic phenotypes, and cardiovascular disease in low and middle income countries. Dr. Hu serves as Director of Dietary Biomarker Development Center at Harvard University. He has published a textbook on obesity epidemiology and more than 1,400 peer-reviewed papers with an H-index of 300. Dr. Hu served on the USDA HHS 2015 Dietary Guidelines Advisory Committee. He has served on editorial advisory board of the Lancet Diabetes and Endocrinology, Diabetes Care, and Clinical Chemistry. Dr. Hu was elected to the National Academy of Medicine in 2015. Dr. Hu?
Thank you. It's my pleasure to talk about nutrition and diabetes prevention and also diabetes complications. I want to start with this concept of food as medicine, because it now has become very important in terms of using food to prevent chronic diseases, including diabetes. The food as medicine concept is very important and relevant for Asian American community. As you know, around 7% or 23 million Americans are of self-reported Asian ancestry. The largest Asian American groups include Chinese, Indians, Filipinos, Vietnamese, Koreans, Japanese. And the majority of Asian Americans are actually foreign-born or immigrants. For many chronic conditions, such as type 2 diabetes, Asian Americans are more likely to be diagnosed at a younger age or at later stage and have a worse prognosis. And many Asian Americans have high prevalence of unhealthy lifestyle behaviors, such as smoking, unhealthy diet, physical inactivity, and inadequate sleep, and also poor social determinants of health, which include inadequate social support, lack of acculturation, discrimination, racism. And also there has been this continuing myth of the modern minority for Asian Americans, and this stereotype has actually exacerbated health disparities and the mental health crisis among Asian Americans. So why are Asians, including Asian Americans, at higher risk of developing diabetes compared to whites? There are many risk factors for type 2 diabetes, but one of the most important risk factors is high prevalence of abdominal obesity among Asian Americans, even though Asians tend to have lower BMI or lower body weight, they tend to have higher percentage of body fat and higher amount of abdominal fat, given the same BMI compared to whites. And also Asians have other higher prevalence of other diabetes risk factors, including sedentary behaviors, smoking, exposure to air pollution, stress, and also unhealthy dietary factors. Another important factor for Asian Americans is early life exposure to undernutrition or malnutrition in early life, including during pregnancy or as infants or during childhood. The traditional Asian diet is basically a plant-based diet. It has been shown to have many beneficial effects on diabetes and other chronic diseases. There are many beneficial components of the traditional Asian diet for prevention of diabetes. Those include high intake of green leafy vegetables, cruciferous vegetables, high consumption of beans, especially soy products, legumes, high consumption of nuts, including peanuts and seeds, healthy cooking oils, and high consumption of herbs and spices, which are rich in polyphenols and other phytochemicals, and also healthy beverages such as green or red tea, and also high consumption of fermented vegetables rich in probiotics. However, when Asians immigrant to America, there are many changes in their dietary patterns that are cause for concern in terms of increasing risk of diabetes and other chronic diseases. Those changes include higher consumption of Western fast food, consuming more soft drinks and other sugary beverages, and consuming more red meat, processed meat, and then eat more refined grains instead of whole grains. So those dietary changes predispose Asian Americans, especially immigrants, to higher risk of obesity, diabetes, and other chronic diseases. This is a study we conducted in India, looking at the effects of brown rice, white rice, and also a combination of brown rice with legumes, blood sugar, and the insulin responses in overweight Asian Indians. Here, as you can see, compared to white rice, consuming brown rice and brown rice with legumes significantly reduce both blood glucose and insulin responses, especially postprandial glycemic and the insulin responses. So this study suggests that consuming whole grain products like brown rice and also combined with legumes are beneficial for glycemic control compared to consuming white rice, which is typically highly polished and refined, and it has much higher glycemic index than whole grain products like brown rice. And also legumes contain higher amount of fiber and also plant protein. So for diabetes management, it's important to eat healthy and high quality carbohydrates. This is a study we published just a few days ago in British Medical Journal, looking at different types of beverages and mortality risk among people with type 2 diabetes. What we found is that regular consumption of sugar-sweetened beverages, including fruit drinks, is associated with increased total mortality, cardiovascular mortality, and also cardiovascular disease incidence. On the other hand, consuming unsweetened coffee or tea and also plain water reduce the risk of total mortality, cardiovascular mortality, and cardiovascular disease incidence. So this study indicates that consuming healthy beverages and unsweetened coffee, tea, and plain water instead of sugary drinks like soft drinks or fruit drinks and even fruit juices is important for the prevention of diabetes complications and the mortality risk. In recent years, the gut microbiome has attracted a lot of attention in nutrition research. This is a study we published recently in Nature Medicine. What we found is that eating more plant foods can improve gut microbiome by increasing diversity and abundance of a gut microbiome. And we know that our gut microbiome is made of trillions of bacteria and other microbes, which play a very important role in digestion, metabolism, immune function, and also brain health. There are several dietary strategies that can be used to promote healthy gut microbiome. This include consuming high fiber foods, especially whole grains, nuts and legumes, consuming more probiotic foods like yogurt, miso soup, tempeh, kimchi, and also consuming more prebiotic foods such as garlic, onions, leeks, oats, and ginger. So many of those foods are traditional Asian foods and can be used to improve gut microbiome and the reduced risk of diabetes and other chronic diseases. And the good news is that type 2 diabetes is largely preventable. In this study, we found that up to 90% of new diabetes cases could be prevented through changes in diet and lifestyle factors. Those include eating a healthy diet, as we discussed earlier, and exercise regularly, at least a half hour per day of brisk walking or more vigorous type of exercise or physical activity, and get enough sleep and manage weight, maintain a healthy weight is the most important aspect of diabetes prevention. Do not smoke, and also limit alcohol consumption. So I think a combination of those lifestyle factors not only reduce risk of diabetes, but also reduce risk of cardiovascular disease and cancer. And also it's very important, those factors can improve healthy longevity and improve overall quality of life. So I'm going to stop here. Thank you again for your attention.
Screening Asian American adults at the BMI of 23 has significant impact. As we all know, early detection is the key to better manage diabetes and prevent its complications. Joslin AADI is proud to be leading the Asian American, Native Hawaiian, and Pacific Islander Diabetes Coalition, which was launched in 2010 in Hawaii, together with NCAPIT, American Diabetes Association, and many other organizations working to ensure access to care and education we all deserve. National Screen at 23 campaign was launched shortly after AANHPI Diabetes Coalition was established. Several states have passed the resolution so that the providers can make sure to screen Asian Americans who are at risk. Please visit our website to learn more about the latest of this campaign. Now let's move on to the next presentation.
Dr. Christina Wee is Senior Deputy Editor of Annals of Internal Medicine. Prior to joining Annals in 2019, Dr. Wee was an Associate Professor of Medicine at Harvard Medical School, where she continues to maintain a faculty appointment, and a clinician investigator and practicing primary care physician in the Division of General Medicine at Beth Israel Deaconess Medical Center. Her prior leadership roles include being the division's Associate Chief for Research and Director for Obesity Research. Dr. Wee's prior research focused on obesity, weight stigma, and health disparity, and patient preferences and medical decision-making around obesity treatment. Her work has been funded by numerous foundation and NIH grants and includes the multi-center longitudinal cohort study to understand patient preferences, decision-making, and outcomes associated with bariatric surgery. An outstanding investigator and mentor, Dr. Wee has served numerous national scientific committees and was inducted into the American Society for Clinical Investigation in 2012 and the recipient of several regional and national awards, including the 2011 Mid-Career Research and Mentorship Award from the Society of General Internal Medicine. Dr. Wee?
Thank you for that kind introduction. My name is Christina Wee, and today I'm going to talk about obesity in Asian Americans and specifically talk about how one size really doesn't fit all. I'll first start by defining obesity in Asian Americans, and then I'll talk about how Asian Americans develop diabetes at lower body weights than some other populations. I'll briefly discuss how food and nutrition affect health, especially in diabetes. And then finally, I'll talk about some strategies that I use to advise patients on how to best improve diet and weight control. As many of you are probably aware, obesity is defined by body mass index, or BMI, which is calculated by taking someone's body weight in kilograms divided by their height in meters squared. It's important to note that BMI is not a direct measure of obesity or body fat or adiposity. It's really a proxy that we use because it's widely available, pretty straightforward, and inexpensive. So standard BMI thresholds that define obesity are largely based on longitudinal observational studies that look at the relationship between body mass index and the risk of mortality and other health consequences. Many of these data were done in Caucasian and European populations, and so our traditional cut points were actually based on these earlier studies. So as you can see on the slide, we define overweight by someone having a BMI of 25 to under 30, and obesity is defined by a BMI of 30 or higher. But other studies looking primarily at Asian populations actually suggest that obesity-related complications occur at much lower BMI in Asians than in other populations. And so these standard thresholds actually underestimate risk in Asian populations. So much so that in 2004, the World Health Organization published guidelines recommending that we use different cut points and thresholds to define overweight and obesity in Asian populations. And they recommended using a threshold of 23 to 27.4 to identify those who are overweight, and to use a threshold of 27.5 and above to define obesity, as opposed to the higher BMI of 30 by standard criteria. Unfortunately, the guidelines published by the WHO has been sort of very slowly adopted in the US particularly. And in fact, the CDC still use traditional cut points to track obesity even in Asian populations. And this next slide shows the prevalence of obesity over time by race and ethnicity in the US. As you can see, the prevalence of obesity has risen quite substantially over the last 3 decades. If you look to the right here, the prevalence of obesity in white adults is currently 42%. It's 50% in Black adults. But in Asian Americans, the prevalent estimates using traditional cut points is still pretty low, just exceeding 15%. But, you know, so recently, the Annals of Internal Medicine published a paper by a group from the CDC to really try to understand obesity prevalence among Asian Americans overall, as well as Asian Americans ethnic subgroups, to try to applying these new WHO standards. And they use self-reported data from the 2013 to 2020 Behavioral Risk Factor Survey. And they had to use self-reported data because, frankly, measured height and weight are not collected in enough Asian Americans by the CDC for them to really estimate obesity prevalence at the ethnic subgroup level. And so these are unfortunately the best data that we have. So this next slide looks at the obesity prevalence among Asian American men using these data. The solid blue bars represent the obesity prevalence if you use the standard BMI of 30 and higher, and the striped bars look at obesity prevalence once you use the Asian specific threshold of 27.5. So the two bars on the left show you the prevalence of obesity in non-Hispanic whites and Black adults. And as you can see, they both exceed 30%. Now, these estimates are much lower than the estimates I showed in the earlier slide because these are self-reported height and weight, which tend to underestimate the obesity prevalence. But I think the importance here is to look at relative differences across these groups. What you'll note is that when you correct the obesity prevalence estimates by using Asian-specific cut points for the Asian populations, you'll notice that the obesity prevalence is much higher than previously recognized. The other important point to note is that there was quite a bit of variability across Asian subgroups. So, for example, Filipino and Japanese men had the highest obesity prevalence, so much so that they actually approximate those of white and Black adults. In contrast, Chinese Americans had one of the lowest obesity prevalence estimates. This next slide shows a similar pattern in American women, although some of the estimates are slightly different, but they still highlight that Filipino and Japanese women had the highest obesity prevalence estimates, along with Asian Indians among women. Now, as I mentioned, the adoption of the WHO cut points have been slow on the uptake to define obesity risk, but there is increasingly a recognition that standard cut points don't necessarily apply to Asian populations. So in 2018, the American Diabetes Association, and in 2021, the US Preventive Services Task Force recommended that clinicians use a lower BMI threshold to screen for diabetes among Asian Americans. Now, in terms of obesity management, however, the adoption of these WHO cut points are still pretty slow on the uptake. And in fact, many patient-facing and public-facing educational materials don't acknowledge this important distinction. This next study that we published in Annals about a year ago tries to look at diabetes screening by race and ethnicity in the United States and tries to come up with, the right BMI and age thresholds for screening. And these authors used data from the National Health and Nutritional Examination Survey, which collects not only self-reported health data, but also measured height and weight, collected medication data, and also measured hemoglobin A1C, which they then use to estimate diabetes prevalence, both diagnosed and undiagnosed, across BMI and race and ethnicity. This next slide shows the BMI distribution in US adults aged 37 to 70 with diabetes across different race and ethnic groups. As you can see, in the first figure here, the mean BMI for white adults with diabetes was just under 34 kilograms per meter squared, while in contrast, among Asian adults, the median BMI of those with diabetes was only 26.2. You'll also note that for the other racial and ethnic groups, the median BMI among those with diabetes more closely mirrored that of white adults. This next slide shows the prevalence of diabetes across race and ethnicity in the different weight categories. What you'll note here is, regardless of the weight category, the lowest prevalence of diabetes was among white adults, as shown by the white bars here. In contrast, regardless of the weight category, the highest prevalence of diabetes was among Asian Americans, which are shown in the lightest green bar here. And I now want you to focus on the results with the yellow arrow. What you'll notice that among normal weight adults, or I should say normal weight Asian Americans, the prevalence of diabetes is almost double that of the prevalence in white adults who are overweight. Similarly, when you look at Asian adults who are overweight, their prevalence of diabetes is very similar to the prevalence of diabetes among white adults who are obese. I think these results essentially support the WHO guidance in terms of really trying to recognize that diabetes and other health complications associated with obesity actually occur at much lower BMIs for Asian populations, including Asian Americans. So what can we do about this? Before I talk about nutrition and health, I just want to acknowledge that a lot of the contributors to rising obesity prevalence in this country and frankly around the world has less to do with individual health behaviors and decision making and more to do about the change in our environment, especially the change in our food environment. We now have an overabundance of cheap, nutrient poor, but calorie dense foods, particularly sugar sweetened beverages. At the same time, there is a reduction in affordable healthy foods and a rise in food deserts and food insecurity. And all of this contributes to rising obesity prevalence. I think we in healthcare and public health also take some responsibility for sending mixed messages and conflicting research on what constitutes a healthy diet and really adds to the confusion. And I think even though our genetic pool hasn't changed over time, it's important to note that, evolutionary pressures have selected for metabolic efficiency. And so we are physiologically more ready to sort of react to famine than we are built to react to this environment of plenty. And finally, the rise in technology has changed the way we work and play, and really trying to be active needs to be something that's intentional versus something that's part of what we do when we're working during the day. So what can we do though? I think there has been long-standing evidence, primarily from observational studies, that poor dietary pattern is associated with adverse health outcomes, including a rise in mortality, cardiovascular risk, cancer, and other chronic conditions such as diabetes. But, the specifics of what is the most optimal diet, is sort of up for debate. Nonetheless, I think while most guidelines can vary, I think they all emphasize certain core principles. And those are, first, I think most guidelines would agree that we should try to limit our intake of unhealthy fats, including saturated fats and trans fat. Refined sugars, sugar-sweetened beverages, simple starches, and other simple carbs also should be minimized to the extent possible. Most guidelines recommend a reduction of excessive use of sodium or excessive use of alcohol. And while there's debate about how harmful red meat might be, I think most people would agree that we should reduce the consumption of red and processed meats as much as possible. And finally, I think most experts would agree fruit and vegetables, legumes, nuts, and whole grains are sort of part of a healthy dietary pattern. I will want to note that food is more than just a source of nutrition. It's really the way many of us socialize. It's part of our cultural identity. It's a source of pleasure for many people. And it does improve our quality of life. And so when I think about giving advice about how to improve diet, I really use several core principles. First, I generally focus on portion size and trying to focus on the amount of food people eat as opposed to the very specifics of the combinations as a first step. However, I think it's important to note that there are more healthy food options and some less healthy ones. And so nevertheless, I try to keep it simple and structured. Most randomized clinical trials would suggest that it's less a matter of what diet that you follow, but more important that you have a dietary strategy, that there's structure to the way you approach food consumption, and that most calorie restricted diets are equally effective in producing weight loss. Having said that, especially in the context of diabetes, I tend to emphasize on reducing simple carbs, such as refined sugars. And I think in the Asian diet, culturally, at least I've been brought up to use sort of the rice and the noodles and the starches as the base, and then adding the meat and the vegetables as accessories to that base. But in reality, that's probably not the healthiest way to eat. And so what I would recommend is sort of consistent with the My Plate campaign by the USCDA, which is really, when you're looking at your plate, you should think of half your plate as being filled with mostly vegetables and some fruit, and really allocating just a quarter of your plate to starches and a quarter of your plate to protein. I think that's sort of an easy way to think about how to work to improve your diet. Having said that, I think, a lot of us do take pleasure in eating. Doesn't mean that you can't have any food, but it does mean that you probably want to minimize the less healthy foods and eat that in smaller quantities. So just to summarize, obesity prevalence in Asian Americans are higher than previously recognized, and it varies by different Asian ethnic subgroups. And the prevalence in Filipino and Japanese Americans in particular is quite striking and mirrors that of white adults. And I think that really speaks to the importance of thinking in a more nuanced way when we talk about obesity in different populations, and frankly tracking obesity prevalence in more granular ethnic subgroups, and not just look at populations as if they were homogeneous. I think I've shown some data that suggests that Asian Americans develop diabetes at much lower BMIs than white adults. And so I think we should think about incorporating the WHO Asian-specific thresholds, not just screening for diabetes, frankly, but I really think they should be incorporated in obesity guidelines for treatment and management and screening. And finally, we need to acknowledge that changing your behavior, including your diet, can be difficult, but I think it's achievable if we keep it simple and just try to do the best you can, and don't let the perfect be the enemy of the good. Finally, I just want to end by pointing the audience to two important resources that the American College of Physicians have put out. We've recently launched our obesity initiative, and we're really committed to advancing equitable obesity care. So Annals of Internal Medicine has curated an overweight and obesity special collection on annals.org that basically puts in one place all the obesity-related content we've published since January of 2019. And the ACP has also developed important educational materials on our obesity learning hub, which you can find on acponline.org/obesity hub. So thank you very much for giving me the opportunity to speak today, and I'm happy to answer any questions.
Ms. Karen Lau is a registered dietitian and certified diabetes care and education specialist at Joslin Diabetes Center in Boston. She provides patients with tailored nutrition and diabetes management care plans to help them attain better health and improve diabetes control. Her area of interest include tailored care and advocacy for Asian Americans, prevention and management of gestational diabetes and type 2 diabetes, and utilization of technologies for better diabetes management. She's experienced in conducting community outreach seminars, nutrition workshops, and cooking demonstration to the public. Ms. Lau is also involved in updating national guidelines, including the 2019 American Diabetes Association's Consensus Report of Nutrition Therapy for Adults with Diabetes or Prediabetes, and also the 2022 National Standards for Diabetes Self-Management Education and Support. Ms. Lau?
Thank you for the introduction. Today, I'm going to share with you how a traditional Asian diet can help you to prevent and manage diabetes. So just to start off, this actually comes from one of the studies that we've done. At that time, we were thinking, how is someone, when they come to the States, their diabetes rate has increased? So we asked the question, how when someone changed from a traditional Asian diet to a more atypical Western diet will affect their health. So let's take a step back before we look at the results. So let's look at what is a traditional Asian diet and what is a typical Western diet. So for Asians diet, we look at, some studies look at the compositions of the carbohydrates, fat, and protein, and as well as fiber. So we see that whether it's East Asians or South Asians, the amount of carbohydrates is about the same, roughly about 70%. So a little bit higher carbs than a US typical Western diet, which is roughly about 50%. As for fat, so the Asian diet, there's a bit less fat. So roughly about 15 to 17%, while for a typical Western diet, the fat percentage is 33%. As for protein intake, they're all about the same, so 14, 15 to 16%. But one thing that is different is that for the Asian diet, the amount of protein, majority of it is from plant-based protein, while for the US, majority of it is from animal-based protein. And as for fiber, the Asian diet is also higher in fiber. So we see that there's 15 grams of fiber per 1,000 calories intake, compared to the US is 15 grams of fiber per day of intake. So that's quite a bit of difference. And so with that in mind, so we did, we designed the study to have the Asian diet as well as the Western diet given to our participants. And we tried to see what are the changes to the health. And one thing we see that when the participants were on the Asian diet, their weight decreased, as well as the insulin resistance also decreased. And when they were on the typical Western diet, their weight increased and the insulin resistance increased. So we see that like by following a traditional Asian diet, it helps in losing weight as well as improving their insulin sensitivity, which helps with their diabetes management as well as prevention. Then the next question is, so how are we eating today? Are we more like an Asian diet or more of a typical Western diet or somewhere in between? So if we look at the food that we are eating, the kind of ingredients that we use or the way of cooking probably is more like Asian foods, like the ingredients that we use. But if we look at the macronutrients composition, that is, if we look at the amount of carbs, fat, and protein, it's actually like a Western diet. So the way that we're eating, we might be still choosing the traditional ingredients, but the way that we're preparing it, it already makes it a Western diet. So that means that our risk of having diabetes has increased just by the way that we're eating. So what we should do is since we have changed our way of eating away from the traditional Asian diet to a more modernized Asian diet or a more like, typical Western diet, we should switch it back to a more traditional Asian diet. We can enjoy our ingredients of a traditional Asian ingredients and also the health benefits from a traditional Asian diet. So what can we do? So certain things, so starting off, the way that we're eating now is more processed grains. So we can change the type of grains to more unprocessed, like brown rice or whole wheat noodles, like the soba noodles, or we can use some fibrous starchy vegetables that we like in our culture, in our foods. So for example, pumpkin, corns, carrots, those are carb and they're fibrous starchy vegetables. And the other way that we're eating now is more animal-based protein. Instead of, like I shared, traditional Asian diet is more plant-based protein. So one thing we can do is we will choose more the plant-based protein, like things that are from beans, lentils, and kinds of legumes or their products such as tofu. And we can also choose more the seafood and leaner cut meats. So, for example, we have a chicken, we will take off the skin. So to lower the amount of fat, so then we can, cut back the amount of fat we have and choose leaner cut as well. And the way that we prepare, we want to use more like steaming instead of deep frying as well. That also helps to cut back the amount of fat. And the other thing that we have these days is probably the way that we eat. We're high carb, but it's like probably we have forgotten about the fiber part. So the vegetables are not as much in it. So we oftentimes when we go out to order, maybe we just have a dish of fried rice or noodles. So what we can do is we add more vegetables to it. And the idea is to add a rainbow color of vegetables. So you want vegetables of different colors. So you get all the benefits from all those nutrients. So that's how we can change a way of eating back to a more traditional Asian diet. So if you want more information, our website, aadi.joslin.org, have some recipes for you and also have some meal plan that is from our study. So you can go and take a look and get some idea and brainstorm to make a healthy traditional Asian diet.
Thank you so much for the wonderful presentations. As our panels mentioned, it is concerning to learn how Asian Americans can develop type 2 diabetes at lower body weight. However, the good news is that type 2 diabetes can be prevented, and there are so many things we can do in our daily lives to prevent its complication as well. Maintaining healthy weight and early screening for diabetes is the key. Also, there are many benefits of the traditional Asian diet we can incorporate in our meal planning. We all know that food is culture, something we hope to enjoy with our loved ones. Let us learn more about the traditional Asian diet and celebrate our culture with delicious and healthier meals.
Now, I'd like to ask our panels some of the questions we often receive from our patients and in the community. What kind of Asian foods do you recommend for a healthy diet?
So what kind of Asian foods do I recommend? I think what is probably easier to say is what to try to minimize. So I would think about prioritizing your vegetables. So when you're cooking or when you're eating out, really making sure that the vegetable portion of the meal is overrepresented, and also really cutting down on rice or noodles or whatever your starch of choice is.
So for Asian food, there are two main things that I would recommend. One, as a lot of Asian food that we're eating, for a lot of Asian culture, we have rice. So one thing that I would recommend, if possible, is to change it to brown rice. Or if you're new to trying brown rice, at least half and half to try to mix it in. And the other thing that I would recommend is to add more vegetables of different colors. So we have, for example, purple, there's such as eggplants, and there's also mushrooms. For Asian cuisines, there are a lot of different types of mushrooms that you can use. Dark leafy greens, vegetables, and okra. Those kind of vegetables you want to add as many different type of color as possible to each meal. That would be the best.
That's really a good question. We know that the traditional Asian diet is a plant-based diet. And in general, it's very healthy, and many studies have shown that the traditional Asian diet is associated with lower risk of diabetes, cardiovascular disease, and cancer. But of course, there are many different components in the traditional Asian diet. Some of them are very healthy, and of course, not all of the components are equally healthy. But I want to emphasize several Asian foods or Asian diet components that can be incorporated into a healthy dietary pattern for everyone. So, for example, the Asian green leafy vegetables are very healthy because they're rich in fiber, minerals, antioxidant vitamins. And so it's very important to incorporate abundant amount of green leafy vegetables in your diet. And then tofu and other soy products also very healthy component of the traditional Asian diet. Those products contain high amount of plant protein and also healthy fats, and a high amount of polyphenols. And many studies have shown that tofu and other soy products can improve your blood cholesterol and blood pressure. And then some fermented foods like miso soup, kimchi. Those foods contain a high amount of probiotics. Those are live bacteria that can help to improve your gut microbiome. And we know that the microbiome is very important for digestion, for metabolism, for prevention of diabetes and other chronic diseases. And also Asian dishes typically have high amount of ginger, garlic, leek, and those are prebiotic foods. So, and those foods high in fiber and other plant compounds, they are called prebiotics because the bacteria in the gut really like those foods and then can convert some component of those food into healthy bacteria. So that's why those foods are called prebiotics. And then in terms of beverages, unsweetened tea, either green tea or red tea is very healthy beverage, and certainly it's very important to drink those healthy beverages instead of soft drinks and other sugary beverages.
I have recently moved here from Asia. Anything I should be careful about foods here?
That's a very good question. So for the way that we eat in the United States, oftentimes, especially when we're eating out, the portion size is much larger than what we're used to in Asia. So keep that in mind. You might not want to finish everything from the plate. You might want to portion some out and bring some home. And the other thing is that the amount of oil used in restaurant foods are typically higher. So going back to what I shared about the traditional Asian diet, we want it to be less fat. So be careful of the amount of fat in those restaurant foods.
Yeah, so especially for recent immigrants, studies show that the longer an immigrant lives in the US, the higher the risk of obesity. And I think that has to do with acculturation and the Western diet. So to the extent that you're interested in, I would actually try to maintain, eating in the same portions that you used to do, in your home country, as opposed to trying to acclimate to the American diet.
Right. Yeah. So I think the food environment is very important. It's very different in the U.S. Compared to that in the Asian countries. In this food environment, of course, there are fast food restaurants everywhere, and also the widespread consumption of unhealthy beverages like soft drinks, and also many snacks and also desserts contain high amount of sugar and fat, and the consumption of red meat and processed meat is very high in the U.S. compared to that in Asian countries. And another big change, of course, is portion size. The portion size is much bigger in the U.S. than that in Asian countries. So I think it's very important to be mindful about those changes. So I think it's important to minimize consumption of fast food, minimize consumption of unhealthy beverages, especially soft drinks, and be careful about sweets and desserts and snacks, which are very high in calories, sugar, fat, and sodium, and also moderate consumption of red meat and processed meat, and be mindful about the big portion size. So those are the issues I think it's very important for anyone, including especially those new immigrant, to consider when they want to adopt a healthier diet in this new food environment. And of course, it's important to continue some of the healthy aspects of traditional Asian diets when you come to the U.S. As mentioned earlier, high consumption of plant-based foods such as soy, nuts, and fermented foods, and also vegetables. I think those are very healthy aspects of the traditional Asian diet that I think we all should continue to consume.
Do we need to prepare different foods for a family member who has diabetes?
Well, that's the interesting question. So certainly food preparations and consumption patterns should be adapted to individuals' diabetes condition and their medications. In general, I think for people who have diabetes, they need to cut back on high starchy foods like white rice and white bread, and also should minimize consumption of sugary drinks, especially soft drinks. And it's also important to consume high fiber foods like fruits and vegetables and legumes and beans. Those foods not only high in fiber, but also high in plant protein, in minerals and antioxidants. And eat more whole grain products like quinoa, brown rice, and barley. Those whole grain products have much more fiber and also less processed than white rice and the white bread. Nuts, including peanuts, can be incorporated into meals and also eaten as snacks. So nuts contain, even though they contain high amount of fat, most of the fats in nuts are good fats. Those are monounsaturated fat or polyunsaturated fat, which are actually beneficial for your blood lipids and blood pressure, and have been shown to reduce risk of cardiovascular disease. And also, of course, for people with diabetes, it's very important for them to be physically active and maintain healthy weight. And so the combination of eating a healthy diet, being physically active, and having a healthy weight can substantially reduce the risk of diabetes complications and also, of course, improve the quality of life for people with diabetes.
Yeah, so, you know, cooking or eating foods in the context of having diabetes is very challenging because, you know, we have to watch our sugar and starch intake. So I would, again, it's really more about portion control and trying to minimize simple sugars and refined carbs in our diet. Not to say that if you have diabetes, you can't ever have a dumpling or you can't ever have noodles, but really be thoughtful about how much you're eating and making that a special occasion as opposed to maybe what you do every day, and prioritize, you know, vegetables and fiber and lean proteins, including fish.
We don't need to prepare different foods for people in our family who has diabetes. So all that we shared about healthy eating, it's for both people with diabetes as well as without diabetes. So those are just healthy eating for everyone. So everyone in the family or friends, when you're sharing a meal, they will benefit from more unprocessed grains as well as more vegetables. So just share the same food.
What can someone do to prevent diabetes?
So, you know, the strongest predictor of developing diabetes is obesity or being overweight. And so to the extent that you can try to control your weight and prevent weight gain or lose weight if you're already overweight, the better you'll be in terms of your diabetes risk. So how do you do that? You know, we know from studies that being very physically active and really watching your caloric intake is the most important thing. Now, it's less important really about the specifics of, you know, counting calories, and more important to kind of do a assessment of what you currently eat and trying to figure out how can you cut 200 to 500 calories out of your diet every day and prioritizing eliminating simple carbs and refined sugars to start.
So we talked about healthy eating. So that's one very main thing that we can do to prevent diabetes. And other than that, stay active. Ideally, for each week, you want to have 150 minutes of moderate intensity exercise, such as brisk walking. So you can do it by spreading it out throughout the week, 30 minutes for 5 days a week. So stay active. And also make sure you sleep enough. So aim for 7-8 hours of sleep each night, as well as manage your stress. So those are all things that will affect your blood sugar. So by managing that, that will help with your diabetes. And if you need more information or more materials, check out our website. We have a series of talk that's called Let's Talk About, which we talk about stress management, how to eat healthy, how to stay active. So yeah, you can find more information there.
Yeah, for someone who don't have diabetes, I think the most important thing one can do to prevent diabetes is to maintain a healthy weight, because high BMI or overweight or obesity is the most important risk factor for developing type 2 diabetes. It's very easy for people to gain weight during young adulthood or middle adulthood, especially in this unhealthy food environment. So maintaining a healthy weight through a healthy diet and exercise, I think, is extremely important for the prevention of diabetes. For Asians, I think because some people even have a lower risk of lower BMI and lower body weight, they still have higher risk of developing developing type 2 diabetes. So I think it's important to use lower BMI cutoff point, such as 23 instead of 25, to screen for your blood sugar, and also it's important to watch not just your weight but also your waist size, because high abdominal obesity is a serious problem for Asians. And then, of course, being physically active, not smoking, and adequate sleep. Those are all very important lifestyle factors for maintaining a healthy weight and also for prevention of chronic diseases like type 2 diabetes. Another important factor is alcohol. Too much alcohol is really bad in terms of diabetes and other chronic diseases, and also, of course, is an important risk factor for accidents and injuries. So moderate alcohol consumption is okay. Less than 1 drink per day on average, I think that's fine. But for people who don't drink alcohol or who don't want to drink alcohol for various reasons, they don't need to start consuming alcohol for the prevention of diabetes or other chronic diseases. So not too much alcohol. If people choose to drink, I think is fine. And then combined with healthy diet, adequate sleep, being physically active, not smoking, and maintaining a healthy weight, that combination of those factors can go a long way to prevent diabetes and also other chronic diseases.
Thank you. These are great guidance for us in doing what we can to live a healthier life. As an immigrant myself, there were many things I first noticed when moved here, especially the portion size in this country. Hopefully this program can help you remember what to be mindful of. We hope you can share what we learned today with your friends, colleagues, family, and members of your community. Hopefully this can help us start conversations about what we all can do to take steps in preventing or better managing diabetes. I'd like to thank Joslin Diabetes Center, Beth Israel Deaconess Medical Center, and our panelists again for their valuable presentations.
Thank you so much.
Thank you.
Thank you.
This month, we're happy to share the latest episode of Joslin AADI's Let's Talk About video series. In this episode, Dr. Sally Ho, physical therapist from California, and Ms. Jackie Shahar, Joslin's clinical exercise physiologist, they will talk about how we can move forward. By improving your balance and mobility, we will learn how mind and body are connected, try some moves we can do at home to improve the balance, and learn how it helps our daily life moving forward during and beyond COVID.
For more information, please visit our website at aadi.joslin.org. Thank you.